Thank you. Good evening, Nhlanhla, and to your viewers. I think it's very clear that on the two things that are being assessed, one being safety and the other one being efficacy. On the safety issue, there are no concerns at all. I think that's actually quite clear. There's no debate about that.
So talk us through the findings that show that the vaccine had failed against the new variant.
Yes, and this is very important, is the second outcome of efficacy, to see whether the vaccine actually works. First of all, I must commend the scientists for doing these trials in South Africa, because then we are able to work with local data and local results. If we were using international results, we would have assumed that the AstraZeneca vaccine has got high levels of efficacy, because in the UK it works, but for us it doesn't quite work. So we are seeing here that when we're looking at the old variants, the AstraZeneca vaccine is effective at 75%, just like in other parts of the world. But when we are looking at the new variant, it's only 22% protection against mild and moderate disease, which basically does not offer any, from a scientific point of view, any significant result. So that's why we are concluding that against mild and moderate disease, it does not offer protection. But here it's important that we note that it was not tested against severe disease.
Right.
So there are no results in terms of severe disease.
I want to take from the Financial Times headline. So its headline story reads that Oxford AstraZeneca jab fails to prevent mild and moderate COVID from South African strain. What do we know about the findings of the study and what does it show?
Yes, so the findings basically are the ones that were presented tonight to show that actually when you look at the two groups, those who received the vaccine and those who received the placebo or basically no vaccine, the results are the same, even though we are seeing a 22% is not significant. So basically, there is enough evidence to show that there is no evidence of protection against mild and moderate disease here in South Africa. I must say in Nhlanhla, though, that even in the Financial Times and other news that they put out today, they kept saying, AstraZeneca kept saying that, look, there is reason enough to believe that it will be protective against hospitalization, severe disease, and death. And this is being extrapolated based on the Johnson & Johnson vaccine, which uses a similar mechanism. But otherwise, the results are disappointing.
So please assist us here, especially for the layman. This mild and moderate disease, just explain to us what exactly is being meant by this.
Okay, so this is important. When they were doing this trial in South Africa, they looked at people who are well clinically. So these are people who are less than 60 and these people without comorbidities. They even only included a small number of people with HIV, but they did not present those results. So basically, we're looking at people who are well. And when we're looking at people with no risk factors, these are people who generally suffer from mild and moderate disease. In South Africa, so far, we've seen that severe disease, admissions, ICU, and mortality usually is seen in people who are older and people with comorbidities, people with risk factors. We don't have results on those people. And as a result, people with mild or moderate disease basically presents with minimum symptoms that are often treated at home, or basically if they have some lung infection, they cough and whatever, but generally they can be treated out of hospital. Some may end up in hospital, but basically never really need high care, don't really need to go on oxygen most of the time, or high flow oxygen, but definitely never go to ICU. So this is the issue. We are talking about that category of patients. The people that end up in high care, needing high flow oxygen, needing ICU, and being critical, we are not able to make any comments about those at this point.
Well, Prof, thank you very much for your time.